Welcome to Rockford Sexual Assault Counseling Winnebago County Community Mental Health Grant Impact video, featuring outreach therapist services and adult survivor group. In the FY25 year, RSAC has achieved success with the Winnebago County Community Mental Health Board funded services. RSAC outreach therapists have continued to be successful, seeing 149 clients, with a total of 1,483 counseling sessions completed. Let's take a listen while outreach therapist Sheila Rodriguez talks to school counselor Miss Betts.
All right. Thank you, Miss Betts, for coming and talking with us today. We just have a couple questions about services that are provided into the school. The first question is, what prompts a counselor in the schools to refer to RSAC?
So when a student shares up and open up to us, it's for their benefits that we reach out to RSAC, because we know that the therapists at RSAC all their therapy is focused in healing them. We know that RSAC can come to the schools, work with our student schedules. They can actually have a whole hour of therapy, and that they're gonna be taken care of every week.
Perfect. What changes or differences have you seen in kids as a result of RSAC providing services in the school?
I've seen them being more comfortable. Usually before they open up and share their experience, they are usually more shy, more quiet. They are always having this burden in the back of their heads. And once they start receiving therapy, I've seen them focusing more in their futures, in their own happiness, and more in the present. Doing usually way better at school, at home, with friendships. Overall, you can see them happier.
Perfect. When considering agencies to refer to, would you say it makes a difference that RSAC can continue offering services over the summer and even after they graduate high school?
I think that is one of the biggest benefits, because once school is done, for the summer, the students are still healing. They still need to be taken care of. They still have questions. They still have doubts. And when you leave them alone for a long period of time, they can regress in their progress. So I think it's amazing that that RSAC can see them either by Zoom, or the students can come here at the offices. Also, I've seen a lot of my students still keep in touch with their therapist after graduation. And what I heard is that they are blossoming, they're healing, they are doing better, they are living more in the present.
Perfect. If RSAC was not able to get into the schools or be seeing students in the schools, how likely do you think it would be for some of these kids to let me start this again. If RSAC were not able to be into the schools, if we were not able to see kids there, how likely would it be for kids to obtain sexual assault therapy?
I would say they would not receive therapy, because first of all, since they already open up and shared with their school counselor about their experience, they are trusting their school counselors to refer them to the right person. Secondly, a lot of our students do not have transportation, or they would be too shy to open up and go to a stranger. But if their school counselor is there to be like, you are gonna be fine, you are gonna be taken care of, they are more likely to try it out at first, and then they will see the benefits and stick with the therapy.
Okay. The last question, what feedback have you received from students that utilized RSAC services?
Sorry, what did you say?
What feedback have you received from students that have used RSAC services?
All of them absolutely love their therapist. They feel comfortable. They feel like they are understood, that they are heard. That is not a taboo anymore. That is at least somebody in the world that can listen to them. And I think more than they speaking, I've seen them growing. I've seen them happier. I've seen them more independent, just being more themselves.
Perfect. Well, thank you so much for your time. I appreciate you coming in today.
RSAC's new older adults group has had 14 participants over the FY25 year with an overall 4.6 out of 5 satisfaction with group
Welcome to Rockford
topics.
Sexual Assault Counseling. My name is Shar Wittenberg. I'm a therapist here. I've been here for about 19 years. I do the 50+ survivors group that has been funded by the Winnebago County Community Mental Health Board. This group is offered on Thursdays from 2 to 3:30 at no cost to the clients or to the public. The group provides an environment where you will meet other survivors in their age range, that they can share their other mental health experiences as well as sexual assault abuse experiences. This group will be ongoing. The topics discussed in this group will be loneliness, mindfulness awareness, intimacy issues, trauma, how it affects our lives, relationships, healthy and unhealthy. 50+ survivors to have an opportunity to share their personal experiences, mental health issues, their sexual assault abuse issues, and the stigmas that are placed upon them in this age range by the community.